Good evening, everyone. This is Dr. Jyoti Yadav, gynecologist, obstetrician, and fertility specialist with more than 15 years of experience. I am a consultant at Kamla Hospital in Gurugram, and today my topic of discussion is PCOD. It is a very common and upcoming problem, and nowadays every single, or we say the every alternate query is about PCOD. There is lot many awareness which is going on in the schools, in the adolescent age group, in the married females, in the patients who are like suffering from infertility. There are n number of problems because of PCOD, and that's the reason I am here today to solve the queries regarding PCOD, any questions, any confusions, and I'll take you to the journey how this PCOD. Sometimes it is said as PCOS. So, what is PCOD and what is PCOS? PCOD is polycystic ovarian disease, whereas PCOS is polycystic ovarian syndrome. So, polycystic ovarian disease is a lifestyle disorder, we say, and it is comprising of n number of biochemical changes and hormonal changes which occurs in the body. And due to the disturbance of the hormonal profile, there are like symptoms which appears in the form of different things in according to the age group. PCOS starts from like your adolescent age group, and the adolescent, when she presents with the symptoms like irregular periods or scanty periods, then they seek the advice of the gynecologist, and on investigation we find on ultrasound, basically the mode of investigation in like adolescent, when there are like bulky ovaries and the ovary shows multiple follicles which remains less than 10 of size, we say the ovaries are polycystic. The volume also increases and the number of follicles are also increased. So those ovaries are called as polycystic ovaries. Now, when we find polycystic ovaries in adolescent, and we are not targeting on anything but the symptom of the patient at every stage of the life. So in adolescent, when we say the patient comes with oligo like menorrhea or like scanty periods, we say, or irregular periods, then this picture comes. There is like polycystic ovaries. We go for hormonal assay of the girl, and if the all the hormones which are diagnostic of PCO, the insulin resistance, then we have the testosterone, dihydroandrosterone. There are like n number of other hormones as a triad or as a like a combination in polycystic we order for any patient along with the polycystic ovaries. And the physical appearance also, like the cosmetic symptoms, like the adolescent girl will have like pimples on the skin, she'll have the facial hair growth, she'll have a truncal obesity. There is a typical obesity pattern in polycystic girls, so that we say as like the truncal obesity. And they are like it is difficult to lose weight for themselves, the patients are little obese. And for cosmetic also, sometimes the like the girl is seeking advice from the either a cosmetic doctor or from a gynecologist, that she has like so many facial hair on her like face, or the pimples, or the we say the oligomenorrhea, scanty periods, irregular periods. These are the symptoms which she presents to like the clinic of a doctor. Now, when there are like adolescent girls which comes with the ultrasound report and say, doctor, I am having PCO, please tell me what next to do. So we need to start the treatment as per the requirement of the patient. If it is like hormonal disturbance, like in scanty periods, we start the patient on hormones. We tell her on the like we tell her about the cosmetic corrections which can be done by the cosmetic doctor or the cosmetic centers regarding the facial hair or the pimples by the dermatologist. So these different specialties come together to treat a single disease for different symptoms. The role of a gynecologist is to relieve or to treat the hormonal imbalance which is occurring in the body, and the hormonal profile is being regulated and the periods become okay. Now for like obesity, when we say because of PCO, yes, we need to have the lifestyle changes, or we need to teach the each and every PCO patient about the lifestyle modification, as without that it cannot be corrected or it cannot be taken out from the root cause. So lifestyle has to be emphasized, and this is the first and the foremost thing I emphasize on, so that in longer run we don't suffer the symptoms, or it is corrected in a better version. Now when a patient in a married age group comes to the clinic, generally her complaints remains either in your or like scanty periods or irregular periods or no periods, and all the cosmetic like features which I told earlier also. Along with this, the complaint is infertility in a married couple. So the cause of infertility, again, the PCO is the cause for infertility. I'm not saying it is the only cause for infertility, but yes, it is one of the causes for infertility. So the couple needs to be investigated thoroughly. Both the partners has to be investigated and started on treatment. And while doing treatment, or like we go in little depth in case of a married female, if she is having PCOD. So all the hormones, again I say, the insulin resistance, the other hormones is being investigated, along with the ultrasound, which again says bulky ovaries, the volume of the ovaries is on a higher side. There are like multiple follicles. And for pregnancy, where we need one dominant follicle, in PCO we don't get generally a dominant follicle. The follicle remains below a certain level of size, and that's the one of the feature which is said as polycystic ovaries. Now after investigating and after making it clear that the specified patient is having the polycystic, and if the patient is obese, then again the thing is, patient has to go for weight reduction if she wants to become pregnant and if she wants to have her periods regularly. So a normal BMI, that we say a patient can only have the more chances of conception if she falls into the weight category of her normal body metabolic, like basal metabolic index or normal BMI. And for obesity, again there are a number of options available for the patient, whatever she wants to choose, but the baseline remains that she needs to reduce the body weight and comes in her normal BMI. And the moment she comes into the normal BMI range, she has a better chances of conception, she has better chances of ovulation, she has better chances to lose weight, or we say that regularizing the periods even. So in whole, the lifestyle which people are adopting, or people are having junk foods, oily food, spicy food, alcohol intake, smoking, all these factors collectively plays a role in having PCOD. And in order to have, and a cumulative effect of all these leads to even infertility. And even in the later age group, the chances of having few of the carcinomas, also cancers, also increases in the later age group if it is not being diagnosed or treated well in time. Now the treatment options, I will cover up few of the treatment options. So in treatment options, again I say it is a multidisciplinary approach where different specialties have their role. As I said, if it is your irregular periods, if it is your scanty periods, then yes, we do put the patient on hormones in order to regularize her cycle, in order to have monthly cycles on a regular basis. We put her on hormones, and that too, the dose is being decided by the gynecologist depending upon the different conditions which we see on examination or on investigations. Now this is the treatment for her periods regularization. Then coming to the next complaint, which generally PCO patients says, they are obese. So the weight reduction options, there is a drug which the drugs which are commonly used, or nowadays the patient also even knows, is met PCO, or we say the metformin. Now there are advanced versions of metformin and inositol in different combinations available in the market, which we start the patient on. And with the help of metformin and inositol combinations, patients are they are able to reduce the weight to a better extent. They are helping her in like ovulation, helping her for like conception. So a beautiful drug which is being used in case of PCO patients. Now the thing which are like your cosmetic things, like your pimples, your what say a facial hair, the laser reductions are available. Sometimes it is the facial waxing which people are opting for. There could be a dermatological opinion about the pimples so that there is no scarring in the later age group. And the things are to be diagnosed at a proper age, and the treatment should ideally be started at a proper age so as to avoid the later age like cancers, which we say in case of polycystic, if it is not being treated and diagnosed at an appropriate age. Now I would love to hear the questions or queries which somebody, like anybody of you, can ask. Yes, one question. How can combined hormonal birth control pills be used to treat women with PCO? See, birth control pills, or we say hormonal pills, these are all combinations of estrogen and progesterone. The quantity and the amount is being decided by the gynecologist, and the birth control pills are in different combinations, can be used as birth control pill, it can be used as to regularize your cycles, it can be used as withdrawal bleeding option to us. So the same pill acts in different way, so has to be taken only in observation or only after prescription of a doctor with proper consultation. I would say a single pill has different roles in different scenarios. Any other question if somebody is like willing to ask me? And PCO is a correctable situation. The most important is your lifestyle. So that needs to be corrected for even PCO, and in a longer run will help you to have to avoid n number of problems in your life. Can PCOS affect your chances of getting pregnant? Yes, I said PCOS is one of the causes for infertility even, and again I would say it is treatable, and the patients who have PCO and are infertile have a very good chances of conception with a proper treatment and with the proper guidance of the doctor. What effect can weight loss have on women? Yes, as I said, weight loss has a major important role in PCO. When the patient becomes comes into the normal BMI, she starts automatically having a better hormonal balance in the body. The insulin sensitivity becomes even more better, and there is more regularization of cycle, more chances of having ovulation, more chances of having conception. So weight loss plays a major role in treatment as a treatment modality, I would say, and that's why I say it is a like lifestyle disorder which needs to be treated and taken care of in spite of a disease, I would say. Any other questions? How can insulin sensitizing drugs help treat women with PCOS? As I said, insulin sensitivity is the cause, is the like plays a role in the like causative factors of PCOS. So the drugs which we have in the market, like metformin, which are again related to insulin, so they are used for the treatment of like PCOS, because insulin sensitivity is one of the causes. Any other questions? Does PCOS put you at a risk of other serious conditions? As I said, if it is not being treated, like infertility is one of the problem which patient can face. There are like irregular periods. One can think it as a a major problem, but infertility definitely is a problem. And in the later age group, the cancers. How is PCOS diagnosed? Yes. So there are the biochemical markers. There is a like set of investigations where we do the hormonal profile of the patient, and then the ultrasonography, which tells the status of the ovaries. It is bulky. It is having multiple follicles. The volume is increased. So all these conditions, all these investigations in total makes the diagnosis of PCOS. Who can get PCOS? Anybody can get PCOS, but the factors, as I said, the like influential factors like smoking, alcohol intake, your hormonal imbalance, smoking, then your junk food, the oily, spicy, everything. This whole thing contributes to its causative factor. The age group, it is common. It starts in the age group of adolescence even, but many times it is diagnosed after the marriage when patient lands up with infertility. Our treatments, yes, as I said, PCOS is treatable, and as I earlier told that it is a lifestyle disorder, so the lifestyle modification is always open to everyone. And if it is being adopted, a healthy lifestyle is adopted, there are less chances one girl will develop PCOS. And if in case she develops, then there are like a number of treatment modalities at present available to the gynecologist, and it is very well treated. And the proper diagnosis and timely diagnosis is the only thing which needs to be taken care of. What can irregular menstrual periods lead to? Okay, it can lead to your like emotional upset, it can lead to your like stress level, it can lead to your unwanted pregnancies. So these are the things, I think, common things which can disturb you if somebody is having an irregular menstrual period. Okay, high levels of androgen can lead to your facial hair growth. All the male type of symptoms are because of like androgen excess in the body. So the facial hair, the hair on the chin, body hair, the more growth of body hair, more glands, sebaceous, like oily glands, are secretory glands are open up, and whole body will show more hair growth, and this is because of the androgen excess. Oily junk, I would say, smoking, alcohol, these are things. And exercising daily is one of the most important modality to treat PCO. You cannot quit your exercise. You have to have the weight loss. You have to have to be in the weight range of your normal body weight, in the normal BMI, and that's the thing you need. You cannot quit. No, 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 not at all. PCOD is not the cause of death. That's the extreme situation you have asked me. Yes, one can drink, definitely. One can drink milk, not an issue. Your lifestyle is the most triggering factor for PCOD. As I said, lifestyle, lifestyle, and lifestyle. That's the basic root cause for PCOD. Your excess weight gain, your sedentary lifestyle, you don't exercise, you smoke, you booze. So these are the factors which leads to. So I would say in PCOD, the only one thing, you have to have an active lifestyle. You cannot have a sedentary corporate lifestyle where you sit, where you don't do exercise, you eat junk, you have no regular timings of your food habits are totally damaged, destroyed. And after modifying your lifestyle and adopting a healthy lifestyle, a proper, if you have any kind of symptom and you feel like having PCOS, consult your doctor at a proper time, and at the earliest, I would say, take a counseling, take a proper guidance of the gynecologist, or like any other specialty, like I said, for dermatology, pimples, and like cosmetic. So the whole special multi-specialty approach will make you like combat this disease. And it is, I would say, it is not even a disease, it is a lifestyle change program. So it is very easily treatable. So be active, do exercise daily, drink enough water, have a healthy lifestyle, walk the stairs, whatever activity you want to do, whatever sport you want to do, live a stress-free life, and you will be get rid of like PCOS. And this is what I want to tell you. And for any further queries, you can connect back to me on this PCOS or any other thing you want me to talk on. Thank you so much for the patient hearing.